Thank you. And hello, I'm David Whitesock. I am the CEO and the founder of Commonly Well. I'm also the creator of the Resilience Capital Index. It is the survey that is at the heart of this initiative that we're going to talk about here today. I'm really grateful to have been working with the county now for the last almost 4 years, to help provide some data and some outcomes measurement to substance use and mental health services in the county. The tools that we use, or the tools that we're going to use here, to look at the county in a much broader view. Our work at Commonly Well is really to measure health well-being of individuals, sometimes going through some really challenging things, but also to track and measure their growth over longer periods of time. So we can utilize those tools, which is what we're going to do here, to apply them to the broader scope of the county to really get a picture of the health and the well-being and the resilience of Palm Beach County. So we're going to walk you through how we're going to do this, how it's going to work, and how you can participate in this project and in this initiative. So the objective is pretty simple. We are going to look across the county, and we are going to map through a well-being survey, a health and well-being survey that measures resilience and quality of life. We're going to map the needs and the strengths, the assets, the capital that individuals use for their day-to-day. But when we bring all that data together, various stakeholders are going to look at those results to make better decisions, to operate better processes for problem solving and solutioning. All of that together, along with allocating resources in a much more targeted and efficient way, are going to help improve the health and well-being and the resilience in the future for Palm Beach County. So that's our objective. How are we going to do it? Think of what we're doing as a large scale public opinion survey. So you've probably seen those and participated in some even. And so we're going to try to get a representative sample of as many county residents as we possibly can. Of course, we want to keep it in reason. There's some challenges to try to get a whole lot of survey responses, as you can well imagine. But our focus is going to be on a representative sample of county residents. And so what we need is about 4,000 responses. We're going to obviously need to do a whole bunch more responses, because as we put this survey out in the field, we're going to get some responses that are going to be outside of the county. We'll probably get some responses that are incomplete. And of course, in order to get a representative sample, we need a big, wider number than just the 4,000. So we're going to use a lot of different communications channels, some that are going to be within the media, some that are going to be through email distribution. We're going to have promotional events, a lot like this one here, Facing the Crisis. We may have a webinar or two. There's going to be information and flyers that you're going to be able to see and utilize that will connect people to the validated surveys that are going to be collected together that make up this survey. And so the three primary validated surveys that are really at the heart of the information that is being collected have all been tried and tested and published on over the years. One is the Resilience Capital Index, of which, of course, I've developed. There is the World Health Organization's Quality of Life Measure, and then also the Cantrell Self-Anchoring Scale. You probably don't even know the name of that, but you've probably heard what it measures, and that is happiness around the globe. It's two questions. We've baked them in, and we're going to look at life satisfaction for the population of Palm Beach County. Again, how we do this is going to be across 2 survey periods, both in the fall and the spring. Again, looking for a representative sample in total over those 2 different waves. But each period is going to be really important as we start to look at the preliminary data and then, of course, the final data. The survey itself is a web-based survey, so clicking on a link, going to a browser, and completing the survey. That is a pretty tried and true method of doing surveying this way. And so there'll be a lot of different access points to get to that web-based survey. One is going to be the way that you're going to experience it today. You've already noticed that there are materials around, and some of you may have already started to do the survey, and that's perfectly fine. But we're going to give you a prompt to do that with a QR code. Some of you are going to get an email in the coming days if you work for the county, or maybe you are part of another business that is participating to be an ambassador and promoting the survey at their businesses and in their communities. You're going to see prompts to engage in a keyword to text message into an automated series. And that's going to deliver the survey link itself and a lot of other messages over time so that you can see some of the different resources that might be available, other encouraging messages to help share the message, and even follow up in the spring. So you'll go into the message once, you'll be prompted to do it here in the fall, set it and forget it. And then come 5 months from now, you're going to be prompted again to do it. And you'll have to do nothing, just sit back, relax, we'll take care of the rest. So what is resilience capital? Now, for some of you, this might be a new concept. You might be familiar with both those words. So let's just break them apart. Resilience, of course, is the concept where individuals, when knocked down, have the ability or the capability to come back up to that same place that they were before they were knocked down. That's resilience. Capital, of course, that's the assets that one might have that are maybe internal or external that can help them in their own lifestyle, their health, their well-being. And so what the resilience capital index measures are those indicators, those internal, external resources, and the capability when collected together and looked at together and scored from 1 to 100, that ability that somebody has, that resilience that somebody has. And so we can score that and we can measure it, we can track that. And that is what we're going to look at. It cuts across what we call 3 domains of resilience capital. So when you start to really dive into what are the things that make up a person's well-being, their health and wellness, across the literature, these 24 items that you see are really the key contributors. Some of us, all of us, have strengths in some of these areas. Some of us have deficits in these areas, right? Imagine maybe you've been in a job or a career for many, many years, and it was your purpose, but times change, and maybe your purpose has changed a little bit. And so that is never set in stone forever, not for everybody. Family members, we've got family support. Some of that maybe change or move, or we've got social support around us. This is really important around mental health. Of course, having a strong social network that maybe has some of that own lived experience. Our personal capital, of course, is really, integral into our ability. Think of Maslow's needs, the basic needs that we need: food, housing, the ability to work. All of those things are really, really important. Financial well-being, and so you will be, along with everybody in the county that we can engage, are going to be doing an inventory of their resilience capital. That's how we're going to sort of dive deep below, peel the onion, layers of the onion back, and really kind of see where are the strengths, where are the deficits. Now, it's going to be really important that as we are collecting this information, that we have it stored and we're using it in a responsible way. And so Commonly Well is a company that works largely in the mental health and the healthcare space, doing data, collecting very sensitive, protected health information. So we're conducting this. We are going to ensure the access to the data when it's captured and when it's collected. Of course, at the end of this, the county is going to have access to all the aggregate data, the de-identified aggregate data. Some people may voluntarily provide some contact information. The public is also going to get access to that data, of course, so they can see the data themselves and make some judgments on their own through a website and through a facilitated mechanism of dashboards and reports. But really more important that I want to share is that this data is going to be captured in a structure and a data environment that we use that is HIPAA compliant. So because we're typically in our regular work dealing around protected health information, we're using those same systems for this initiative and this project. So think of the highest level of security and protection around some of the most sensitive health information. We are applying that to this project here. So we utmost trust and utmost security and privacy of this information. We like to view ourselves really as just stewards of the data. And this data is only going to get used for this purpose and this purpose alone. What about the results? How are we going to report the results, and when are we going to report the results? Of course, this is a 6 to 7 month survey process between now and through the end of, call it April, May. We're going to have 2 waves of surveying in the fall and in the spring. And so we're going to put the results together, at least preliminarily, in the winter around December. Why are we going to do that? What we have found, and what a lot of folks that do a lot of this work find, is that it helps the population to kind of see where things are going. It encourages participation, and it's going to allow stakeholders who are really engaged in this, maybe you, to kind of get those results early and kind of see, okay, which way are things going, and what is this really telling me now? We want to learn from the data as it's happening. So we're going to make that available with the disclaimer that those results won't be the full conclusion. You can make conclusions, but we will not make conclusions until the final results are reported in June. You're going to see those results in an interactive data visualization on a website dedicated for this purpose. Again, as mentioned, so that it's going to be contained in the ability to see that de-identified data and interact with those results and those visualizations, play with it, filter it, get into it. But for those that want to sit down and curl up with a written report, we'll have that as well. And the results are going to be announced through webinars and through other mechanisms around May and June. So this is where now you get to participate. You are here and we want you to help. And we would love for you, if you haven't already gone around the room and scanned one of those QR codes, we're going to show you that here in a minute. And you're going to get a chance to do that. So first and foremost, how can you help? How can you be part of the solution to shape a healthier Palm Beach County? You just got to participate. And then when you've participated, you've got to tell others. So my call to action for you today is go tell at least 5, right? So whether it's your family members, your spouse, your partner, whoever, other coworkers, send them a text message. Send them the prompt to get into the text messaging flow or the link to the survey and get them to participate as well. Again, the more responses, the wider variety of responses, the most strongest representative sample we are going to get. Please share with your network and your social media. Maybe you've got an internal listserv of your company. You think that's a good use of that resource to get more participation. We really would encourage that, and we would love it. Social media, there's going to be various things that you're going to see through the county shared and other toolkits to be able to share the prompting and the links to the survey. So keep an eye out for that. Look for those kits here around to take those home with you as well. You're going to see flyers that you're going to have access to, and we want you to put those up in your office or around your neighborhood. If you run a small business, we'd love to see that in your business as well during the survey times. The survey time for the spring and the fall, well, for the fall specifically, is now through the end of October. So quite a length of time, a little over a month to get folks to participate and keep them up as you do. And then, of course, when the results start to come out, maybe in December with those preliminary results, please share them. Please talk about them. But when the final results come out in June, we really want you to talk about those, because what we've found is that when people, not only do they participate, but let's say they don't even participate, but when they see that others have participated in a process that resulted in certain conclusions and findings, and that information is going to be used to make certain decisions on their behalf, or that will have an effect on them, it's going to be really important that they see those results. This is what all the materials are going to look like. You've seen some of it around here today. Take a good look. We've got various flyers. There's going to be a mailer that's going out here in the next couple of weeks, so you may see that in your own home. If you're interacting with the county, you're going to see some email signatures start to change. But there's a lot of different prompts and a lot of different explanations about this project and this initiative. Keep an eye out for those. And again, share widely to get as many people to participate. You'll notice that you see that we've got English covered, we've got Spanish covered. We're also distributing these materials and the survey in Creole. So the three most populous languages in the county are all covered in the survey. So here's your chance to participate. This is where you get to take out your phone, hold that up to the screen, and you can choose your language adventure. Creole on the right, Spanish in the middle, English on the left. If you take out your camera, scan that, it'll have a prompt that'll pop up. Tap that, it'll go to your messaging app, hit send. And when you hit send, you're going to get a message back. That message is going to have some instructions. It's going to have a little welcome and a link. That link is to the survey. As I mentioned before, the survey is going to take 10 to 15 minutes. So not a lot of time, but it's an investment in your time to really do that full inventory. And your observation is really, really critical. So you can text any of those words to the language version of your choice to that number. That's your prompt to participate. And again, if you have any questions as you're getting into the text message flows, you get that first message, and over the course of the next couple of weeks, and then over the months as we send out some reminders and some other prompts, if you have any questions along the way, you can always text that number. Our team is managing and monitoring those incoming text messages, and so we'll respond in kind as we can. Or if you've got other questions, the two people that you should reach out to are myself or John Hulick with the county. We can try to answer as many questions as we can. We can also provide other information in terms of the materials that have been developed in digital form, if they're needed. If you'd like them for your business or for your community, please let us know, and we will make sure that you've got what you need to help promote this initiative. Again, so on behalf of the county and the community services department and Be Well Palm Beach County, we're grateful to be part of this initiative to help use the collective wisdom, the collective observation of everyone in the community to assess the strengths of the resilience, the health, the well-being, see where the gaps are, use that information in the months and the years forward to make better decisions for a healthier community. So thank you again. Thank you for participating, and enjoy the rest of today's events.